I would like to take a moment to talk to you whether you're a medical resident, physician associate, nurse practitioner, or a medical PA or nurse practitioner student. Thank you for tuning in. The areas I'll be covering are patient care and safety, documentation, relationship with the attending, relationship with other mid-level providers, relationship with the staff, and your mental health. As a medical provider, you're responsible for providing proper medical care to your patients. I am sure you're quite familiar with the expression, do no harm. Let's begin with patient care. Care for your patients in the way you want to be cared for. You may not know everything, but what you do know it very well. Refer to your patients by using patient first language or the PFL, using preferred name and a noun and not by a diagnosis or body parts. Listen to your patients and give them the opportunity to give a good history. Perform a conscientious physical examination after listening to the history. Based on the history and physical exam, order the appropriate labs and imaging studies to support your suspicion. Make an effort not to keep your patients in pain and be very slow to label them as drug seekers. Remember, compassion is not taught in the lecture hall or in the textbooks. Based on your history, physical exams, labs, and imaging results, you should now have a treatment plan. Before you give a medication, make sure there are no allergies. And if you are in doubt, ask. Do not ignore the inner gut feeling that you may sometimes have in caring for your patients. It's a safety device and it's called gestalt. Become familiar with disposition. That is, know when to admit and when to discharge. But this comes with experience and is also based on patient's diagnosis. Remember, remain humble. You're a servant of mankind. Cockiness and arrogance lead in two directions, down and to the lawyer's office. Let's talk about patient safety. As long as the patient is in your facility, you are responsible for their safety. Practice identifying patients by their preferred names, and if there is any doubt, confirm it with the date of birth. Always ask permission to touch a patient and tell the patients what you will be doing on their bodies. Remember, they have a right to refuse as long as they are mentally intact. Make sure that the discharge papers go to the right patient. It has happened on several occasions where the wrong documents were given to patients. Let's talk about documentation. Your documentation is really telling a story about the patient. Practice writing in full sentences. Avoid abbreviations, especially the uncommon ones. Remember, the chart is a legal document. Never use it to fight with other providers or criticize the care given by other providers. Be very careful how you document differences of opinions between you and your attending. Find out from your institution how long after you sign a chart can an addendum be added, if needed. Remember, your charting reflects who you are, and it's your best defense in the court of law. Never alter the chart if litigation is pending. Let's talk about relationship with the attending. Always be respectful to the attendants. Disagreement will happen, but should be handled in a proper manner. Never lie to your attending. If you're asked about an issue that was not performed, simply say, I did not do it as yet, but will make sure it's completed. If you're unsure about a specific aspect of care, please check with the attending. Do not criticize or bad talk your attending publicly. It's a bad reflection on your character. Let's talk about the relationship with other mid-level providers. Practice being a team player. Provide support to your colleagues where needed. Disappearing during a code is definitely not the right thing to do. Avoid the temptation of throwing your colleagues under the bus, always keeping in mind that today might be their blunder, but tomorrow could be you. And make every effort to maintain a good, respectful, and cordial relationship with your colleagues. Let's talk about the relationship with the staff. Be respectful to the nurses. They are a vital part in the big scheme of patient care and safety. Practice greeting everyone, the clerical staff, the PCTs, and the janitors. They are all part of the team. Remember, you're a person before a provider. Let's talk about your mental health. Maintain a good, healthy mind. If your mind is unstable, riddled with doubts and fear, it will affect the quality of care. Establish an environment of respect around you and be mindful of the boundaries of others. Every day should be regarded as continuing medical education for you. In short, keep pushing yourself and expand your mind. You certainly won't know everything, but make sure you master what you know. Know your limitation and when to call for help. Never do a procedure on a patient if you're uncomfortable of doing so. And try to avoid burnout. Finally, become familiar with the Office of Professional Medical Conduct, short OPMC. They oversee all the medical and legal functions of all providers in New York State. Whether you're a veteran on the brink of retirement, or you may be in the middle of your journey, or you might have just started your journey, regardless of where you are, the value of these tips will protect you as you care for patients. Always remember, interest is the soil in which knowledge grows. Thanks for watching. Please don't forget to like, share, and subscribe. I wish you well. Good night.